Hey guys, happy Monday. Hopefully everybody is coming off of a great weekend and are ready to get back to it to start the week. This week, topic of discussion is going to be upper body pressing movements. And today we're going to discuss some of one of the most common problems people suffer from when trying to do upper body pressing movements, whether you're doing a body weight push-up, you're doing a bench press, you're doing an overhead press, anything of that nature, using your upper body to press yourself or press weight off of your body or over your head. One of the most problematic areas is going to be the shoulder joint. So we're looking at the shoulder joint. There's a lot going on in the shoulder girdle. You got a lot of, obviously you got the joint itself where the bones are connected by the tissue. You got the chest and the pec muscle. You got your deltoid in the shoulder. You got your rotator cuff, all the muscles attached within your shoulder blade to the actual shoulder joint. All of those are going to come in play when you're assessing a shoulder injury. So maybe you have ongoing shoulder pain and it flares up when you do any type of upper body pressing movement. Some areas we're going to look at: the pec, the deltoid, the rotator cuff, and then you got the lat. So all of these tissues are going to have an effect on how well your shoulder can, one, move through proper range of motion, and two, be able to stabilize the shoulder joint properly when loaded with weight. So if you suffer from shoulder pain, especially when doing upper body pressing movements, you probably need to, one, mobilize the pec, especially if you do a lot of sitting, you're in a rounded over position, sitting at a keyboard, sitting at a desk all day long, or maybe you don't have very good strength and stability in your lat, or your actual rotator cuff to help support the shoulder joint to stabilize it when it is loaded up with weight, doing a press off your chest or doing a press overhead. That is going to cause the shoulder joint to get offset, and obviously you're going to have pain from that. So then you need to work on these areas to get the shoulder back in proper position and be able to load it up with proper stability. So if you have ongoing shoulder pain, or maybe you have just suffered a shoulder injury recently, those are the areas you want to look at. You want to work on mobilizing the areas. And then within our level method class, it helps assess that, and it gives you the proper foundational movements to focus on to help build yourself back up. So, shoulder problems, work on the pec, work on the deltoid, work on the lat, work on the rotator cuff, mobilize the joint, get it back to moving through a proper range of motion, and then work on getting proper activation through the shoulder blade, rotator cuff, upper back to help stabilize the joint. So if you have ongoing shoulder pain, give this a listen. Be on the lookout for other things on shoulder injuries with upper body pressing throughout the week, guys. Happy Monday. Hope you enjoy.